Chopping techniques use an angled metal instrument to help disassemble the lens nucleus. They can be a little more difficult to master, but once learned, they help to reduce phaco time, especially with hard nuclei. The chopping techniques broadly fall into two categories: those which create a central space into which the nuclear fragments can be chopped, and those that don't. The latter can be a little more tricky. Stop and chop is the former, and was originally outlined by Paul Koch, who described a central sculpting of the nucleus, then stopping and changing to a chop technique. The stop and chop technique is a useful one to use as an introduction to nuclear chopping, because it combines the familiar sculpting introduction of a phaco procedure with nuclear chopping in a safe environment, and it can be converted to a divide and conquer technique at almost any stage. The initial stages of stop and chop involve making a deep central groove roughly the diameter of the lens. This creates space into which fragments can be chopped. The deeply sculpted nucleus is then divided in half, and each heminucleus further divided by the chopping technique. Having split the nucleus into approximately equal halves, the phaco probe is impaled into one half using high vacuum after tip occlusion. A touch of pulsed phaco may help to bury the tip. A high vacuum is maintained in position 2 of the foot pedal, and the chopper carefully introduced between the lens capsule and the nucleus. The chopping instrument is drawn towards the phaco probe, and a nuclear fragment separated off. The phaco probe is then used in pulsed mode to remove the fragment. This set of manoeuvres is then repeated until all the heminucleus is removed. The second half is then rotated into a position opposite the phaco probe, and the chop technique repeated until all fragments are removed. Stop and chop provides a good introduction to nuclear chopping techniques in a safe environment and does allow conversion to divide and conquer, which may be more familiar to some people.